My name is Diego and I am 29 years old. I have contracted HIV when I was 18. Recently, I have been diagnosed with COVID-19 and I'm trying to adapt to the new challenge. I have to keep positive and confident so that I will be recovered soon. I had a surgery in mid-March. The procedure required a series of special cares. During the recovery process, I felt some of the symptoms of COVID-19, such as headache and cough. Soon, I had fever and anosmia. I couldn't feel any smell or flavor. At first, I got really worried and anxious because there was a high possibility that I was infected by the coronavirus. It reminded me when I figured out I was HIV positive. I felt really vulnerable and very scared. The doctors were really nice the way. They told me about the diagnosis of COVID-19. They motivated me and made me feel safe. They explained very carefully the process of quarantine should start, how the treatment would be, and the prevention measures I should follow. Also, they emphasized how important it was for me to keep confident and positive to overcome it. Everyone is very uncertain about the COVID-19. The people around me are not different. Initially, I thought about it only to my family. It took me a while until I was comfortable to talk to my friends and my community. Regarding the stigma, I have to face some behaviors that made me feel very sad, and there are two situations I had to face. The manager of the building where I live notified me that if I stepped out of my apartment, she would give me a fine. Also, a neighbor who's called me coronavirus. Those are situations made me feel really down and made the process even harder. I am trying to keep confident and positive. I have read a lot about COVID-19 and I have noticed that there is little information about the co-infection with HIV. I am following the public health authorities' recommendations and making people aware of it. But I believe it's necessary to have more information available, especially to the youth, regarding the co-infection of HIV and COVID-19. Unfortunately, I don't know anyone who was the same situation as I am. I remember when I found out about my HIV diagnosis that being in contact with other people in the same situation can really make the difference. Now, with the COVID-19 situation, I miss a supporting group or community where I can seek for peer dialogue. I don't know of any network created to support people with COVID-19 and its side effects, like loneliness, fear, and uncertainty. I believe that is an important strategy to support mental health and recovery of the quarantine side effects. In my personal life, I have felt low self-esteem and loneliness. I try to shorten the distance by connecting with people through technology. I talk to people I love every day and this makes me feel happy. Regarding my job, my colleagues really supported me, but as I work with HIV, I wonder if it wouldn't be more interesting if I were in the front line, developing new strategies to contribute to the Ministry of Health. The pandemic has affected everyone, and that makes vulnerable people even more vulnerable, especially the ones who face more difficulty on accessing the health services of their countries, like the LGBTQ+ populations. Being a young gay living with HIV, I try to be stronger in order to deal and combat stigma and discrimination. I have strengthened the relationship with LGBTQ+ and people living with HIV communities, because I believe that only together we will overcome this challenge. I believe that social vulnerability, stigma, and discrimination faced by the LGBTQ+ and people living with HIV might considerably impact to the protection of the pandemic and the access to the health services. I would like to leave a message of hope and say that we need to deal with this pandemic together, with solidarity and respect to build a network big enough to stop the impacts caused on the lives of the youth that, like me, live with HIV and somehow might be infected with COVID-19. It is essential that we advocate to assure antiretroviral distribution and that the combination prevention strategies be implemented, offering HIV and other STI rapid tests, condoms, lubricants, PEP, and PrEP to the population. Also, it's necessary to rethink the actions towards one another and towards ourselves. I am sure that COVID-19 pandemic will be over, but while it's not, it's time for action.